Well, COVID has certainly put a real stress test on a lot of people. COVID-19 obviously affecting the employment here in Southern Nevada and affecting our healthcare professionals and affecting, frankly, everybody. And our next guest is providing support groups, totally free, by the way, to help those that have been affected most by COVID-19.
That's right. They're available at the Community Counseling Center. And Jody Marshall joins us now. He is the clinical director at the center. And you have a whole bunch of good, positive things going on. Tell us what kind of services that you're offering to people. It's so relevant right now.
Yeah, just understanding that there are a lot of people going through different challenges right now. As a community agency, we wanted to be there to support, the community. So we're offering two different types of support groups. One is for the general public and just community members that may be watching this program, and it's support for any type of issues that are dealing with COVID or that you may be having just as a result of what's going on right now. And then, of course, we also have one that's more specific and geared towards the first responders and healthcare professionals that are on the front lines and working with the crisis on a daily basis.
Yeah, it certainly is quite the challenge. This is really like it's like a stress test, to see how much a community can take. Mental health during COVID-19, man, between people losing their jobs and maybe getting it or being afraid of getting it or just watching the news, this can be a really serious test for a lot of people.
No doubt, no doubt. I mean, we see a little bit of everything. I mean, you have people that are, of course, are more worried about all kinds of things from, how to pay their bills to taking care of loved ones to getting sick themselves to,
Yeah.
How do I keep active and still, find ways to, find enjoyment and stay motivated and connected with those people that I care about. So, yeah, there's a lot of different challenges that we're facing right now.
Yeah.
Oh, there are a lot of different challenges. And one thing that Sean and I have talked about, Jody, is we're noticing that, for a lot of people, all these stresses kind of translate into anger, whether it's like a low grade seething anger, but people seem to be just kind of like ready to pop. I know that many of you have seen it happen, maybe out at a grocery store, at a gas station. You recommend some coping techniques, some things that can kind of help, because we all kind of have to manage ourselves right now mentally.
Yeah, yeah. I mean, in general, there you want to do those things that make you happy. I mean, that's the best way to cope. If there are different things that you enjoy, different foods you enjoy eating, eat those foods. If you like different activities, and even creating new hobbies and starting new hobbies. With a lot of clients that I've worked with, I'm happy when I hear them say they've started, knitting or crocheting or learning a new language. And those people that are more physically active, that are able to get out and do some hiking or bike riding or even, yoga via Zoom, Zumba via Zoom. And so
Zumba.
there's all those different kinds of things
Yeah.
that you can do, and really connecting with other people. Good thing too, like connecting with those people that you maybe not have spoken to in a while. You can find ways to reach out to them, not physically, but still reach out to them. I think that's a good way to cope as well, and that's helping you and the other person.
Yeah, no question. I think there's this stigma around mental health. I think we all kind of grew up with parents that had this policy of we don't, feelings are not a thing you share. Don't you're not going to,
Mm-mm.
we're not going to be expressive about how we're feeling. You just bite your lip
Mm.
and get through the day. Why is it so important to kind of brush that stigma aside and deal with this head on?
Yeah, because the stigma can really delay engagement and delay people getting help and inhibit growth and just understanding what mental health really is. And the way I like to describe it is it's a way for you to personally have your own private person that's going to help you with personal development. It's about whatever goals you want to achieve. And a lot of times, of course, they're emotional and finding different ways to deal with some of those emotional challenges that are causing distress. But again, I like to say that counseling is the only relationship that's strictly about you as a person. And so, as far as those
Mm.
stigmas go, they can just prevent people from really becoming the best person they can be. Because if you have, your own personal, counselor that's focused on those goals that you want to achieve and helping you find new ways to get there, I don't see a negative with that.
Point people in the right direction. Jody, it's great having you. Thanks for joining us.
Thank you, Jody.
Thank you.
All right,
Thank you
CCC
both.
of SN a great place to go. Free, by the way. 702-369-8700 is their number. They're on East Sahara, but they're doing mainly telehealth, although their office is open. We thank them so much for joining us today.